normally, in order to protect the patient during the depth of anesthetic, when you maybe get your patient in and they might have gotten a little lighter and you want to make sure that they're going to be safe on the table, but also on recovery, you want to make sure that they're secure on the table. Body positioning is very important. In certain surgeries, you need to have the abdomen isolated. Certain surgeries, you need to have them in a lateral recumbency, and you're going to want to tie them a little bit differently. Certain patients may have very deep chests. You're going to want to have their arms positioned differently in order to accommodate that. So what I'm going to do is I'm going to give you an idea. Every surgical table will have adjustable ties, little T-shaped portions attached to the bottom that can be opened and moved, sliding up and down the table. There'll be one at all four corners. And we have ropes that already have a secured loop, a hook and loop fastened. So my rope is already creating a loop. The first tie, I'm going to come up to the front paw. Now I'm going to imagine this to be a dog that is not a deep-chested breed. And so I'm not going to cross my legs. I'm just going to extend my legs up on either side of the head. If you had a deep-chested dog, they may be very tippy and have a tendency to slide from one to the other. What you would want to do is make sure that you cross the arms over the chest before tying, so that the left leg is tied cranial and to the right, where the right leg is tied cranial into the left of the body. You want to make sure this isn't it is tight enough to keep the animal straight, but it is not so tight as to compress the chest, because they do need to expand their lungs. So the first tie, you're going to go up and above the carpus, and the second tie is a loop. And then I want to go below the carpus on the metacarpals, and I'm going to tighten. I'm going to extend the leg. You can either go over the head of the table, or you can slide your bar so that it's more to the side, depending on the size of the patient and the length of the table. I've done a figure-8 weave. Most of that is because I want it to be a quick release knot. In the event that there is an emergency, we need to release the patient quickly from the table. At this point, I'll come to the other side of the table, and I'm going to repeat the process with this leg. So, using my looped band, my pre-loops here, I want to go cranial to the carpus. I'm making a loop. I want to go over the metacarpals. It's just tightening. I've just got a loop. I'm going to zoom in on this in a moment, guys. And then I'm doing an 8 weave for quick release. I'm going to repeat the process here. I'm going to go cranial to the tarsus, a caudal to the stifle, and then I'm going to do another loop, and I'm going to go over the metatarsals, and figure 8. So I want to go over the tarsus. So I'm going to be cranial to the tarsus, but caudal to the stifle. And then I'm going to make a loop. A loop like this, so that the under string is aiming back towards the body. I want to loop it through the foot. It's going to be over the metatarsals, and then it's going to tighten. In the end, your system will look like this. So I have my initial loop, the extension towards my second loop, and my loose end that I'm going to tie to the table.